As the world of advanced beauty treatments develop and mature, new methods of technology, concepts and developments are emerging. Our guest, aesthetic physician Dr. Beatrice Nwalie, specializes in non-surgical, minimally invasive cosmetic and anti-aging procedures, and she'll be speaking on the beauty industry in Nigeria, advanced beauty treatments and skincare. Welcome to the morning show. Many thanks for joining us. So, Dr. Beatrice, what is the difference between aesthetic dermatology and generic clinical dermatology as we all know it?
Hi, how are you? Thank you for having me on the show.
Thank you for joining us.
Thank you for joining us.
So with clinical dermatology, you're actually treating diseases and you're trying to find a cure to skin diseases. Whereas with aesthetic dermatology, you're just trying to find a way to improve the skin in general, as in aesthetically, trying to make it look more beautiful, not actually treating a disease in terms of clinical dermatology, where you're treating different skin diseases and you have to use different medicines to actually approach that. But with aesthetics, it's more about beautifying the skin. So I'm just going to put it in a very layman term. One is beautifying the skin and one is treating diseases.
All right, I would like to find out from you. What are the results? Do they get better results? Those white skins and people of color, do they get different results from Botox and fillers? And do they get different side effects from both Botox and fillers?
Well, are you trying to talk about the Caucasians and
Caucasians? Yes, just
black skin?
Yeah, basically black Caucasians and black skin. Yeah.
Well, the truth is that yes, you get different results, and that's why not all treatments that are given to the Caucasians can be given to the black skin, because one of the things that we suffer as blacks is we suffer pigmentation and we suffer keloids and hypertrophic scars. So there are a lot of approaches that the Caucasians might use that I might not necessarily use in my practice, because I'm trying to avoid pigmentations for us. I'm trying to avoid scarring. And just like in cosmetic surgery, a lot of people are going into liposuction, different body enhancements. But if you meet them, one of the things that they have suffered from is scarring and pigmentation. And there's nothing that can be done to that because of the type of skin color we have and the tone of our skin. But for the Caucasians, they can do a lot more treatment. They can even go into CO2 fractional lasers and they will not get scarred. They won't get pigmentations because they have very little melanin in their skin. But we don't. So different approaches must be taken in terms of the skin of color and in terms of the Caucasians.
Okay, now let's talk about the commercial realities of the industry. What is the market size and how much demand are we seeing in the beauty industry in relation to advanced cosmetic procedures? I know that that's a little bit leftist, but what are the realities on ground there?
Well, I must say, I do tell people we are in the age of social media, in the age of technology. Everybody is getting to see their flaws. You know, when you look at when you use your camera phones, you're getting to see your flaws, your imperfection. This was not like that 20 years ago. So the market has actually increased. First of all, it went from people using skincare products, thinking that all skincare products can enhance their beauty, but it's not true. A lot of these skincare products, a lot of them are just different marketing schemes that have been put out there to say it can stop wrinkles and it can stop this and it can stop that. But now people are tilting towards doing more cosmetic procedures because they can see immediate results. Just like with fillers, if you're having wrinkles on your face and you want to take out that wrinkles immediately, dermal fillers can actually do that and give you an instant result, as to using a cosmetic product or a serum that promises to actually remove that particular wrinkle, but it doesn't. You can use it for 10 years and you will continue to see those wrinkles on your face. And the same thing with Botox, botulinum toxin. People are beginning to realize that those wrinkles cannot go out without actually using a drug. So the market has actually increased. And in my practice, I see a lot of women every day coming in saying they want to do one procedure or the other because they don't want to look at their face anymore in the mirror and they're unhappy. So the market has actually increased. There are a lot of people out there doing these things now, but they won't tell anyone because it's a personal decision and a personal desire for you. It's not for anyone else, it's just for you.
But what about the long-term effect of having Botox and having fillers on your face? I mean, we mentioned that. I want you to go into details because right now you've just mentioned the fact that social media has amplified a lot of things in this modern era. And still in Nigeria, we're still a little bit conservative in our thinking and in our perception of beauty because we believe that whatever God has given you, it's yours and you should just be content with that. Talk to us about the long-term adverse effects of using fillers and Botox, especially to Nigerians.
Okay, so Botox has been around since the late 1980s. And I would not just say when you say long-term side effects, that could be very complicated because they're very minimal long-term side effects. They're more of short-term side effects. Like, yes, people have sent me messages and saying, what are these side effects? One of the side effects of using Botox, especially on the upper face, is Botox can actually cause like a disfigurement. If it's not placed properly in the right muscles, it can stop one muscle from working and give your face kind of like a disfigurement. So it has to be placed properly. And then an adverse effect of Botox is actually blindness in the eyes.
Wow.
Which if not done properly, now these things are very, like maybe 1 in 1 million. It doesn't really happen like that. But there have been cases of people who have used botulinum toxin and it has caused blindness. And it was not placed properly because, like, I can give you an example. There's some muscles here. This is called the procerus muscle, and this is the orbicularis oris muscle. The orbicularis oculi muscle. Now, if Botox is not placed properly on the orbicularis oculi, now there's a particular area where you can place it to stop wrinkles. But if placed too close to the eyes, it can actually enter into the eyelids and cause blindness. So this is a technique-based issue, and that will have to be dealt with the practitioner who is doing it. So it's not for every doctor, someone is a doctor, so he can do Botox or fillers. It's not true. The person has to be very trained because those treatments are very delicate, and those areas that they're placed into, they're very delicate. Now with fillers, one of the long-term side effects of dermal fillers, apart from the minimal ones, which are usually swelling, pain, tenderness, is lumps. Fillers can cause lumps, and these lumps, they might not go for even up to 1 to 2 years. Now, they're not visible lumps. They're only lumps that are felt during palpation. So if I feel my skin, I will feel a lump or a nodule in there. And at the end of the day, it's discomforting for the patient, not necessarily for the people who are seeing the person using dermal fillers, but it's for the patient. Also, another thing that fillers can do is fillers can also cause disproportion on the face when it has been placed and put too much on the face. Now, some patients come in and they say they want more and more and more, not realizing that a filler is a volumizer. So apart from being a volumizer, they're also biostimulants, and they stimulate collagen to continue increasing in size, and they also attract water into the skin. So if I place fillers on my cheekbone here, definitely my cheekbones will look bigger. But eventually, if you overdo it, your cheekbones will become disproportional. They'll become too big. And that's why patients must also be able to take the doctor's advice in how to actually look pleasant and beautiful. Some people's idea of beauty is in their own eyes. Like they say, beauty is in the eyes of the beholder. Some people want bigger. Some people want more volume. And it might not really fit their face or their body profile. So these are some of the long-term side effects. But does it cause cancer? Because that's one thing that a lot of people want to know. No, it doesn't cause cancer. There has been no studies of dermal fillers, the use of dermal fillers or Botox causing cancer. And does it cause death? No, there's been no studies or findings that Botox and fillers causes death. So I think that's the major things that it really does. Those are the long-term side effects.
Dr. Beatrice, so it sounds like a lot to take in terms of, if someone is going in for the first time, literally there are so many precautions you have to absorb. Let's talk about what reputable regulatory bodies are out there in terms of ensuring that the right physicians, because you talked about doctors, you have to listen to doctors' advice, but who is this doctor in the first place, and how much do we know about how well they understand what you're about to do?
Oh, that's the thing. We're trying to work on the regulatory bodies in terms of aesthetics right now. So it's just a very new training that has come into Nigeria, and not a lot of people know about it. Even the doctors, a lot of them are not even exposed to the fact that there's something that can be done in terms of body enhancement. So the regulatory body is still under the maybe like cosmetic medicine, where the surgeons are still doing, we're still working with the surgeons to try and see how we can regulate this so that not people can know that this particular person is trained in this particular field, because people are just popping in and out saying, I want to learn this, but I tell them, you can't just learn it like that. It's not something you just wake up in the morning and say, I want to learn. You actually have to go to the proper school for it. You actually have to become a doctor, and you actually have to specialize in aesthetics before you can actually say you do this, because there's a lot to go with it. It's not as easy as it seems. It's quite difficult.
All right, Dr. Beatrice, to simplify that question, how do you spot quacks? Of course, with the story that actually was developing for quite a while, disgraced Dr. Anu Adepoju, of course, being suspended by the Medical and Dental Association. Looking at all that, with all the storm that it brought also, how do you spot quacks and roadside body fillers, Botox injection doctors or physicians out there? How do you spot those quacks in the industry? Help our viewers who are out there, maybe they want to get one and they don't know the right place to go. How do you spot them?
For those people, they don't really know. Okay, honestly, if you meet someone that says they can do a facial enhancement for you, most of them don't really know different techniques. So they end up doing the same thing. They don't know how to talk the talk. They don't know how to do like a typical facial analysis. And most of the quacks, in quote, will only fill your laugh lines. So they will only tell you that, oh, I'll just feel here, and I'll feel here, and I'll feel here, and you're good. And they don't know how to analyze the face. So a lot of them are only doing one thing, and they end up making a lot of mistakes over time. It's quite difficult because, yes, the person is still a doctor. They're doctors, don't get it wrong. They are doctors. They've gone to medical school. So the difference is that they might not necessarily know what they're doing when it comes to the beauty industry. And you will see it in their hand movements. You will see it in the way they talk. You will see it even in the way they inject. It's just glaring in the face. But I also feel bad for the people who are new. They've never done these treatments before. They might not necessarily know how to spot them.
I want to say thank you very much. We're hard pressed for time, but I want to say thank you for joining us here on the morning show.
Thank you.
We've been speaking with Dr. Beatrice Nwalie, an aesthetic physician who's speaking about Botox and fillers here in Nigeria.